Well, we're joined now on set by Catherine Norris-Trent, who has been examining the coronavirus statistics across Europe for us. So European countries hoping that vaccinations will be their way forward as they lift restrictions. Catherine, thanks for being with us. Let's take a look perhaps at France now. The French government also lifting some restrictions today, but I mean, it doesn't look like we're exactly out of the third wave at the same time.
That's right. So some schools are going back this Monday. Primary schools for pupils from ages 3 to 12 and creches are going back. So quite a relief for parents. And the government does say that, social distancing is going to be ramped up, especially in canteens. And they're handing out 400,000 saliva COVID tests in schools this week. And on May the 3rd, we're going to get the 10-kilometre journey distance lifted in France. So they're lifting these restrictions, sticking to their guns on the roadmap they'd originally set out, despite the fact that we've still got quite a lot of, high COVID number infections. I've crunched the numbers. The last 7-day average was 30,485 new infections a day. Now, that is down a bit from 4 weeks ago. If you look for the week starting the 21st of March, the average then was 36,650. So we're down a bit, but it's a high plateau at around 30,000. And hospitalizations, there are around 30,000 people hospitalized with COVID in France. So this is not quite as high as the peaks in the first and second waves, but it's not far off. And if you look, I've got a graphic here we're going to bring up. If you look at the number of people in intensive care units across France, you can't quite see it perhaps on there, but there's nearly 6,000 people in intensive care, more than during the second wave in France. So there were around 5,000. Not as many just yet as during the first wave. That was around 7,000, but it is going up. It was up on 1% from last week. And, a lot of intensive care units are still saturated, especially in the Greater Paris area.
Indeed, and those statistics quite a bit up on what they said would be the level that we'd need to avoid going into lockdowns in the past. But of course, things are opening here in France, and it's not the only place. We were looking there at Italy, but indeed across Europe, it seems that the move is now to lift restrictions.
Yeah, in many countries. So we were talking there about Italy with CIMA. They're starting to ease COVID restrictions today. 14 of its 20 regions going into this yellow zone with shops open, cinemas, theatres, cafe, restaurant terraces, being described as a big gamble. Belgium also is gradually lifting restrictions after its Easter pause as well. Schools for younger people have now reopened. Non-essential travel restrictions have been lifted. And as of today, businesses which have non-essential businesses where there's contact with the public, like hairdressers, are reopening, and restaurants and bars will be allowed to open starting on the 8th of May. So gradually they're opening up. The Netherlands has been in various stages of lockdown for more than 6 months. Now a nighttime nationwide curfew that's been in place for 3 months is going to be lifted April the 28th. Bars and restaurants will be allowed to serve small groups on outside terraces up to 6 p.m. That's despite the coronavirus infections there and numbers in intensive cares have climbed to their highest levels since January in recent weeks. There is an amount of popular pressure. And talking about other countries too, look at Greece. They've said they're reopen to tourists from all over the world as of May the 15th. And you've got to remember, of course, 20% of Greece's GDP comes from tourism, and the economy clearly been struggling in recent years. So that's a big factor there.
Indeed, the economy clearly having a major role in this, what looks like a change in strategy. And of course, it comes as, we're starting to see those vaccinations arrive.
Yeah, I think it's clear that it's safe to say that governments in Europe, including here in France, are now counting on mass vaccination programs as the key to the problem, hoping that when they can get large proportions of their populations vaccinated, infections will drop off dramatically. There was a lot of talk about Europe's slow start to the vaccination program, but, vaccination drives across the continent have really been picking up. In France, more than 14 million people have had their first vaccine. More than 5.5 million have had 2 doses. Now, we are far behind countries like the UK or the US in terms of numbers, but France is now vaccinating on average 350,000 people a day. So it's picked up a lot of speed. And crucially, there are a large number of Pfizer vaccines. A lot of the stocks are due to arrive in EU soon. Some interesting remarks by Thierry Breton, who's the EU Commissioner for the Internal Market. He said recently that the EU should receive more than 500 million vaccine doses by July. That's enough to entirely vaccinate 2 doses, 70% of the EU's adult population. And by September, the EU is counting on getting 800 million doses, more than enough to entirely vaccinate all of Europe's adult population. And I think this is part of the policy shift we're seeing away from prioritising hospital saturation at all costs, which we saw definitely as an argument in the first wave. Now governments seem to be factoring economic costs, psychological costs, and the feasibility. Will the public continue to follow COVID rules long term? It is getting harder to force people to stick by them as COVID fatigue really kicks in, and this summer that's likely to increase. There's already a lot of popular and political pressure in some countries in Europe.
Let's hope that those vaccines stay rolling out and remain effective. Catherine Norris-Trent, thanks a lot for that look at the situation across Europe.